Hi there, my name is Kieran Leong, and I'm one of the founders of onwARDS. And our goal at onwARDS is to improve survival from respiratory failure. So this is the face of respiratory failure in America today. Patients require a breathing tube, a ventilator to stay alive. I want to talk specifically about acute respiratory distress syndrome, a lethal form of respiratory failure. It has about a 50% mortality rate and costs the U.S. about $9 to $16 billion per year. A specific proning therapy exists out there called proning, which has been shown to decrease mortality in people with ARDS by half. And because of this strong literature, in 2017, all the major critical care societies in the United States and abroad have now strongly recommended proning for patients with ARDS. Despite this, adoption of proning is really poor. Only about 10 to 30% of patients end up getting this life-sustaining therapy. And that's due to issues of awareness and safety concerns, both for staff and for patients, as well as the resources associated with the current solutions. So the current solutions right now are not very satisfying. Manual proning requires about 6 to 8 people to turn patients. Very resource intensive, high risk for staff and patient injury. A rotoprone bed exists to do this automatically, but this costs about $1,300 per day, and this is not widely available to most hospitals due to the cost. We imagine a solution that is a single-use, disposable solution that is compatible with current beds and is designed to reduce the effort required to prone therapy in order to decrease or increase adoption of this life-sustaining therapy. We have an attractive business model based on compelling hospital savings that has been shown already to reduce the ICU length of stay. And we imagine an average sell price of $4,000 with attractive margins, which comes out to a potential market of about $770 million. This is our team, myself, a critical care physician, Amy, an intensive care nurse, and 2 engineers that are well equipped to help bring this product to market.
So you said the device is disposable. It's $4,000 per unit?
Yes.
And it requires 2 people?
2 to 4 people. So we did some human testing that showed that we're able to decrease the force. It kind of depends on how big the patient is to begin with, but at least by half. So if we typically say 6 to 8 people, we're talking kind of 2 to 4 is what we're imagining.
Could you speak a little bit more as to why you chose this sort of value-based pricing, so to speak, where you're sharing with the hospital, and also how would you administer that?
So currently there's no code out there to exist. Proning is not a medical device or a procedure. So to kind of head down that pathway, we require applying for a code to perform this procedure, which is actually performed by nurses and not physicians. So given that there is already compelling data to show that this decreases mortality and decreases the amount of time on a ventilator by 4 days, we kind of chose that as the marker to kind of go after, the method to pay for it. And especially given that ICU days are especially expensive, we felt that it was a reasonable kind of cost-sharing mechanism to go after.
So when I looked at your pictures, I was thinking, this is so simple. Why hasn't somebody done it before? And what occurs to me is the reason why there's so many people involved is that there's so much care being given to every individual spot on the patient. How do you get around that?
That's a great question. So we got design input not just from, unfortunately, Amy's on our team, but other ICU nurses and respiratory therapists who actually do this procedure. And so our design mainly, we want to just not rotate people, but do it safely. So we put patients within this inflatable device that encases them and prevents movement of required lines and breathing tubes, with also straps on the inside to help accommodate for those safety concerns. Thank you.